Welcome everyone to Releve Sports Medicine's Virtual Journal Club. For additional webinar educational opportunities, you can visit our website and register directly for the webinar, or you can sign up for the email list to be notified of upcoming webinars. We are updating our upcoming schedule frequently, so check back often. For all athletic trainers who are intending to get live CEUs from the BOC, you will receive an email 1 hour after the webinar concludes, which includes a link to the combined quiz, evaluation, and assessment. You will have up to 72 hours to complete the quiz and the evaluation. This email will come from customer care at gotowebinar.com. Please ensure that this is done timely in order to receive your statement of credit. If you don't receive the follow-up email or have any other concerns, then contact us via our email at journalclub@relevesportsmedicine.com. Once the statement of credit is available for download from our website, you will receive an email notification. If you have any questions during the webinar, please submit the question and we will review questions at the conclusion of the presentation. If you cannot see the PowerPoint slides and you're accessing the webinar from your mobile phone, swipe the screen to the left or to the right and the slides will become visible. The recording will be available at our website once the webinar has concluded. Our speaker this evening is Dr. Amanda Nanasy, who is an optometrist specialized in sports vision. She completed her undergraduate degree at the University of Central Florida and completed her school at Nova Southeastern University. I almost put her as going to my alma mater. She serves as the director of the Florida Institute of Sports Vision. She is the team optometrist for the Miami Dolphins, Inter Miami FC, American Heritage School, St. Thomas University, and Barry University. She's the director of visual performance at the University of Central Florida. She serves on the advisory board of the Journal of Sports and Performance Vision. She serves on the advisory board of Sports Vision Pro's Performance Vision Academy. She is also the chair of the Sports and Performance Vision Committee of the American Optometric Association. She will be speaking tonight about the optometrist's role in the sports medicine team.
Hey everybody, are you guys bored yet? That was a fantastically long intro. Thank you so much. That was kind. All right, I'm gonna show my screen. You guys let me know if you can see it. All right, are we good?
Looks good.
All right, perfect. So first off, thanks everybody for joining the webinar, and thanks for the opportunity to speak for your journal series. It's quite impressive, the amount of information that you're getting to share out there with all the athletic trainers, and I just have to say thank you to all the athletic trainers that are out there, because this is just obviously an unprecedented, difficult time for so many of our student athletes, and you know, personally, even a lot of the high school seniors that I've gotten the opportunity to work with that have had some really tough transitions, thinking that they're going to go to one school and then they're changing their athletic programs, and just everything that you're doing to help not only keep these athletes in their sports, but in this interim, keeping them, you know, mentally healthy as well. I think that that's really important. So, all right, our topic tonight, the eyes lead the body, optometry's role in the sports medicine team. I will say that I have a really fantastic area that I get to work down here in South Florida, where so many of the sports medicine teams are really tuned in to how important visual performance and visual health is to our athletes. And there's the little disclosures that I have to have on there. Some of you may be familiar with FitLight. Sports Vision Pros was mentioned in my intro, and that's actually something that I will point to you to look at again at the end of this lecture, because there are a lot of great free resources there for you to go and learn more if you do want to add some sports vision to your team. So I'm going to jump down to the very bottom of this intro and say that my professional goal, of course, you know, I have a fantastic practice here in South Florida, and I get the opportunity to work with a lot of fantastic teams. So my patients, my athletes, my teams are definitely one of my top priorities. My other kind of professional goal is to share this information because I'm sure there are a lot of you on this webinar that are not in South Florida. And I want to make sure that you know what you need for your athletes and ways for you to find those resources in order for you to bring vision care onto your team if it's not already a part of it. And there's also many things that you can do for your athletes to make sure that they're visually fit and ready to stay safe on the field. So there's a lot of information that we're going to do in this 1 hour lecture. So I'll say stay with me as well as you can. And of course, if you have questions, I'm happy to field them afterwards. And of course, you can reach out to me after the lecture as well. If you want to learn more, I am happy to share more. So what is sports vision? Preventative care is the first step. We want to make sure that athletes have healthy vision in order to not only perform at their peak level, but also to stay safe on the field. That's a really big part of why vision care is important. That can include refractive treatment, of course, if you or your players need glasses or contacts. Protection. Protection could be anything from sun protection to I've seen kids actually down here that have had concussions before, and that's the only reason why they were in my chair for an eye exam is the visual symptoms after their concussion. And somehow they got through all of their vision screenings because they could see 20/20 out of one eye, but then they had a congenital issue with their other eye, and they were light perception. So he was on the line playing football, and I said, well, what type of visor do you wear? And he said, I don't wear a visor. So that would be a very important form of protection. He has to make sure that his healthy eye stays safe, right? Because if anything happens to that, he's done. Performance enhancement is definitely, I think, what sports vision used to be most known for, enhancing the way that we can track a ball, the way we can predict a ball, where it's going to go, and that's something that we'll talk about today. And then also the injury care and the rehab after something does go wrong. So we'll start with static visual acuity. Static meaning that your target is not moving. This is your typical VA chart that you have. And I've got the definition right there for you. I will tell you that when you are doing static visual acuity on your athletes, it's really important to change up the line because it's a test, right? And athletes want to perform well for us when we do a test. So you might see them read the TZV-ECL and then cover the other eye, TZV-ECL. You need to make sure that they can actually see the line that they're actually saying that they can read, because again, they want to perform well and they don't think of the implications if maybe they can't see that line and you think that they can. Basics of visual acuity, those numbers, you guys probably all already know. 20/20 is kind of where we put as our standard of what we would call good vision. 20/15 is better than 20/20. That's what we would typically aim for in our office. The average MLB player is 20/12.5. 20/30 would be worse than 20/20. And just a basic way that you could kind of understand what exactly those numbers mean. If someone that has, we'll say, perfect 20/20 vision can see something on the wall from 20 feet away, someone else standing 30 feet away. So if you have the 20/20 vision, you would be able to see from 30 feet away what the other person would have to get 20 feet to see, so closer in order to see it. So that probably sounded more confusing than I meant it to. But what you need to know, especially if you were to be tested on visual acuity, is that 20/15 is better than 20/20, is better than 20/30. Dynamic acuity is how well our eyes can track something in motion, which I'm sure that you can understand that is actually more applicable to sport than just reading a static VA chart. Unless someone's a shooter, they're not often going to need something that's to see something that's just holding still. So there are a couple kind of cool research stats on there that we do see correlation in the dynamic acuity compared to the static acuity. It does get worse with age, and they say males perform better than females at this. I think that we probably just need more research maybe on that. So contrast sensitivity. This one's kind of cool because I would describe regular visual acuity as your quality of vision. We've got that number, that 20/20 number. Contrast sensitivity is more of a quality of vision. So I'm sure that you can understand that two people might be able to see the same line of letters on an acuity chart, but it may be much more clear for one person than the other. That's why we would test contrast. Interesting that this is something that I will often test for contact lens wearers, because if someone is in a contact lens that they don't throw away at the end of the day and they're wearing it for 2 weeks or 1 month, often that contrast sensitivity will go down throughout the month. The lens is still the same prescription. They should be able to see out of it. But if they get any proteins or lipids on the lens, it's kind of like if you had a dirty windshield on your car. So this is often something that we will check for players, especially if they say that they have vision that gets worse throughout the day or throughout the month. That might need to be changed. Oh, side note too, there are some different pieces of equipment that have had research backing them saying that contrast sensitivity can be enhanced with certain training. Also, there are certain nutraceuticals that have been shown to improve contrast sensitivity. And they usually have naturally occurring carotenoids like lutein and zeaxanthin, basically all those things that you see in those eye vitamins that they sell on all the commercials. Refractive status. So this is basically if you need glasses or not. This little picture here is of a portable autorefractor. This gives us an idea of what the prescription would be. We did a vision screening today on a team, and this is of course one of the things that I like to bring into the screenings, because we will often see players that can see okay. They might even be 20/20, but they have some underlying prescription there. They might have some astigmatism there. They might be a little bit nearsighted, but they can kind of squint and see through it, or they might be a little bit farsighted. Farsightedness is interesting because it doesn't often cause problems for our athlete until there is an injury. One of the most common things that I will have happen if I see an athlete that had a concussion, if they come in and they're having visual problems, will be that they had an underlying prescription that they could focus through just fine, but after the injury, they couldn't compensate for it. So I think it's really important to get that refractive status. Dominance is something that many of you may be very aware of, especially depending on what sport you work with. A lot of people will say that there is a little bit of a benefit if you have same side versus cross dominant. So if you are maybe a left eye dominant batter that bats right, they may say that that's an advantage, where most sports vision docs will tell you it doesn't really matter, because even for a baseball player, you want both eyes to be facing the pitcher so you get your best depth perception. The only sport that really can benefit from having a specific dominance are your shooting sports, for obvious reasons, right? This isn't something that you can change. It's something that people are just born with. So ocular alignment is really important for us. That tells us how the eyes are working together as a team. And in general, if you go to an optometrist and they test to see how your eyes are working together as a team, they might just test in primary gaze, just looking straight ahead, which is important because it can give us a lot of information. And the majority of people, if their eyes are straight here, they're going to be straight here, but not always. So this is something for those of you that that I have worked with your athletes, you know that we always test our athletes. If they're basketball players, we check them in up gaze. If they're golfers, we check them in down gaze. If they're batters, we check them in their batting stance, because I want to see what their eyes are doing in their game positions where they're typically playing. Oh, how does eye alignment change perceived distance? So this is kind of interesting. Majority of people, even though your eyes look like they're aimed in the same direction perfectly, if we let one of your eyes kind of rest, so if I say, look at my finger, and I cover one eye, the eye that's behind this hand actually goes to its resting place. And when I switch, then it has to pick up and look at my finger, and vice versa. And for those of you that have a really big monitor, you might be able to tell that my eyes are moving like this, because it's normal for most people at near to have their eyes rest outward a little bit. For some of our athletes, even looking in the distance, their eyes might rest slightly in or slightly out. And what that does is it changes our spatial localization and where we think we are in space. For some people, if their eyes rest in, they might actually swing early or swing late, depending on how the eyes are resting. So something else that we look at. And of course, if there's a problem, if someone is always swinging early or swinging late, this is something that we might be able to correct. Depth discrimination and spatial localization, fancy words for depth perception, basically. This is a picture of something called a Howard-Dolman device. It's one of the best ways to test distance depth perception without one of our electronic devices that we sometimes will take to different screenings. Obviously, knowing where you are in space, how far away things are from you, very important in sport. Accommodative divergence function. This is talking about how our eyes work together as a team. So you probably know that as you have a target that gets closer to you, a couple things happen. One, your eyes come in together, or at least they should, unless you have a problem there. The second thing that happens is your pupil size changes. You guys probably know that. And the third thing is your accommodative system also changes. So those things have to work really well together. There is a little bit of latency in that system, which is why if we're working on things like, hitting a ball as best as you can, we have to look at, can you actually change your accommodative function as quickly as that ball will get to you? And those are the kind of things that we take into consideration if someone does want to do performance enhancement. Because the last thing I want to do, especially if I'm working with trainers that are saying, okay, go ahead, let's work on some performance enhancement with the guys or the girls. I don't want to waste their time training something that can't actually be enhanced above a certain level. So that's something that we take into account. But there are definitely ways to enhance and to train those systems. Peripheral awareness. Can't talk about this enough, because this to me is the key to safety when we're on the field. You have to have really great peripheral awareness, and you can improve your peripheral awareness. It doesn't mean that you can change your visual field necessarily. The brain can only take in information that comes out so far, right? But what you can do is make yourself more aware to things that are in the periphery, and we can train that, which of course would be great for certain sports. If you think about a basketball player or a soccer player that needs to see something happening coming up on the sides, if you think about a football player that needs to be able to appropriately tense their body to respond and not get laid out. That's why blindside hits are so dangerous, right? Because even if you're going to get hit, as long as you can see it coming, you're less likely to have a really devastating injury. So peripheral awareness is something that a lot of people will focus on. I really think that's going to be the key to injury prevention as far as vision enhancement in the future. Your ocular motor function is, of course, very important and something that can be injured or reduced after a head injury. So ways that we test the oculomotor function, there are a couple listed on here that are usually only used by eye doctors, but many of you are probably familiar with King-Devic. King-Devic is a sideline test that can be done to see how well the saccadic system is working. The key with King-Devic that you also should really remember is that you have to have a baseline of this test. Because basically, I believe I have it on the next slide. It's going to be on a slide coming up. I actually have a picture of what King-Devic looks like, but you have to have that baseline in order to see if there's actually a problem when there is an injury. Speed of recognition is how quickly you can actually pick up a target. This is what we would always try to enhance when we're looking at how accurately someone can judge maybe a pitch coming off of the pitcher's hand. That's why we have this example here, but this is something that's obviously important in many sports, not just baseball. Inspection time, that's kind of a cool word that you don't hear very often, but that's what we're actually testing if we're looking at their processing speed. Visual motor response or reaction time. Again, I'm kind of going back to what we think of or what people used to think of when they thought of sports vision or performance vision. And it's a lot of this, how fast can I hit the buttons type stuff, right? Which now they even have in arcades. So I wanted to point out that there has to be a method to the madness. There has to be a neurocognitive element to this. It's not just how fast can you hit things anymore. It's, can you only hit the greens and not hit the reds? Or can you remember a certain pattern or do any type of go, no go response? The picture there is a fit light that's set up on a stand. That was when we screened Hendrix Motorsports. Fit lights are cool because you can set them up in any pattern, in any place. These are some other examples of saccadic fixators. Some of them have elevated tactile buttons and they think that that's a benefit. Some of them don't have any visual cues of where they're going to be. Most of them will have an audio cue. And like I said, if done well, there's going to be a cognitive component that goes with that for sure. Coincidence anticipatory timing. This is a really weird looking gadget. I know that we had set up actually in the meth locker room because we would need a really, really long space. This is how quickly you can anticipate and predict when something is going to make it to you in space. So for this particular device, we use this mostly, well, sometimes for testing, sometimes for training. But if we use this for testing, obviously we don't want to then train on it. We don't want to train on the same thing we're going to test on, right? Train them for the test. But the very end of this has a light that lights up. And all of a sudden, it has a sequence of lights that get closer and closer and closer until it gets right up to you, and you have to swing across the infrared plate to stop it. And it will tell you if you swing earlier or swings late, you swing late. And we use this as well for wide receivers to see how quickly they can anticipate how fast the ball will make it to them. And this is something that we can set up at all different speeds. So very cool. Spatial awareness and multiple object tracking is the other, I think, really, really future for training, similar to peripheral awareness, but just another cognitive step up. Think about multiple object tracking like the ball under the cup drill or the football under the helmet that they do on the Jumbotron. Basically, you want to be able to track more than one thing at a time. And this is an example of NeuroTracker where this player is 1, 2, 3, 4, 5, 6, 7. They're tracking 8 balls at once. So the tennis balls will all pop up on the screen, and maybe 3 of them will light up red, and then all of a sudden they start moving. And you can actually do this with 3D glasses on, like it's a 3D environment. And I think the application is pretty clear. You can train this skill, and it lets your brain basically take in more information at one time. So we know that if we want to successfully train the visual motor system, we need to not only be able to see our targets accurately, but then process what's happening in order for us to make the appropriate decision based on our previous knowledge, our experience, our training, and then have that corresponding motor response. So this is kind of that middle area, that neuro segment that a lot of people don't think about that we can enhance and make better. So right eye is a piece of equipment that we use that actually can break out that difference for us. It doesn't look super cool to athletes. It's just on a computer screen. But what happens is, for example, there is a center target that the athlete is looking at, and then either an alien, an astronaut, or a globe will pop up in different locations on the screen. And this is an example of the readout. It will track their eyes and tell me the difference in time between when the alien pops up and they actually notice that it's there and start moving their eye, the speed that their eye makes it to the target, and then that latency between when their eye gets there and they actually think about it and respond with the corresponding button that they should hit for the alien. So this is one of those tools that I really like to use, not for all sports, just because it does take a little bit more time to do, but for the appropriate sport or after injury, we really like to use this technology. So here's the King Divic. This is actually 4 different cards all shown to you at once. For those of you that have had King Divic for a while, you know that it used to come in these great little flip books that we had, and now it's on a tablet version only is the way that you can get it. But basically your skill that you're doing is you're just reading from left to right as quickly as you can, just like a book, but you can't use your finger, and it's a timed test. So you start off like the top left is your demo card, the one on the right is test 1, and then bottom left, test 2. It gets increasingly more difficult, which of course makes it more difficult to track from left to right. And it's a timed test. So when we do our baseline for this, I'll typically get their heart rate up and make them jog in place, and they'll look at me like I'm crazy when they're there for their eye test, and I'm saying, yeah, jog in place, because it's really easy to sandbag this test. Because if you're just sitting doing your eye test and reading it like this, 37590, and then you're all juiced up on the sideline when you're actually having this test done, even if you're concussed, if you have all that energy, it might not look like you did worse than your baseline, because that's the thing. If you have a time longer than your baseline, it's one of the flags that might get you pulled from play if you are utilizing King Divic. And there's a lot of great research behind KD. They'll say that with a KD, SCAT5 and BESS, you can isolate the majority of concussions. So I definitely am a fan of this, but you know, I have trainers tell me all the time that it would be great, but in reality, it's just not something that can get done. But just know that it is a tool that you can have in your arsenal. This is just another example of a perceptual training drill. This is just something to show you, again, just what's out there. I should have maybe told you a little bit in the beginning that if you haven't already figured this out, one of my goals for you is at the end of this, for you to just understand that there's so much more to vision than just reading that VA chart on the wall, and hopefully you're getting the feel of this. Mobile gaze tracking is, again, something that we've done with many sports, many shooters. This was the pit crew for Hendrix, where they put on these glasses, and then we had them run around and change the tires to actually analyze what they're looking at, because you might expect that when they're changing a lug nut, they're not actually looking at that lug nut. They're already preparing, and their eyes are fixating on the next place they're going before they get there, and it lets us learn more. And again, it's just another cool thing that we can use. These are also things that are important when we're doing visual tests. We check the pressure of the eyes. Things like glaucoma can change the pressure. We look at the back of the eye to make sure it's nice and healthy. The screening that I did today, again, everything's different because of COVID. Typically, I would love to do dilated exams on players, but depending on, especially when we're playing with, when we're screening pro teams, it's just not a possibility to get everybody in, but the more information I can gather, the better. So if I can bring a fundus camera or some other way to look at the back of the eye, awesome. Cameras are also great because I don't have to get right in people's face. We can have a nice safe distance, but look and make sure that there's nothing going on, because the reality of it is, and this is one of the reasons why it's so important for athletes to have their vision checked by an eye doctor, there are a lot of things that could be underlying that just don't have symptoms until they get much worse. Case in point, retinal holes. It's really easy to have an asymptomatic retinal hole. It doesn't really do a whole lot of anything back there, but if you get a little bit of traction on it, like if you have a head injury or if you just get a big hit and everything gets shaken up, if you get fluid under that retina, it could easily cause a retinal detachment. So if I can find an asymptomatic hole, but we say, you know what, I think it's bad enough to get some prophylactic treatment, it's a laser treatment. I don't do it. We would refer it to one of our ophthalmology friends, our retinal specialists, and they could tack that down and potentially save a lot of problems in the future. So we like to dilate. Color vision testing is interesting because most athletes, by the time they get to me, they already know if they have a color vision deficiency. I'd actually love to put some research together on this for whatever reason. A lot of the college athletes that I work with, I've seen a lot of soccer players that have color vision deficiencies, and I don't know if it's a geographical or what it is. But interesting enough, those players are not very interested usually in different ways to enhance their color vision because the differences in their jerseys are so large that it's never a problem for them. Football players, we often have an issue where if someone is color vision deficient, FYI, there's a special type of contact lens that we can put in their non-dominant eye that's called an X-chrome lens. It's actually a red contact lens, so besides enhancing their color, it makes them look kind of like the Terminator, and it doesn't give them magical color vision, it just gives them a better way to contrast between the two colors so they don't accidentally throw it, to a defenseman. This is an example of a sports vision assessment that we can do on the Synaptech station. And again, this is something that a lot of providers might not have, and that's okay. But this is just a good way to visualize some of those different skills that we already went over. And it gives us a nice reading on, where those skills could potentially be enhanced. Striver is something that is, it kind of got a lot of media attention for a while. It's one of the ways that VR can be used in performance training. WinVR is another one that I've seen used quite frequently. For a lot of athletes, this is a great way to get reps in without the risk of injury, especially now with COVID. I think that a lot of teams that have this are probably happy that they do. But high budget, this is something that I would expect for pros in college, not necessarily high school, but good to know that it's out there. So now I'm just kind of getting into something else that is out there that people may not know about. Everybody knows, well, I think everybody knows, that you can get regular glasses that are clear when you go inside, and when you go outside, they get dark like sunglasses. Those are called transition lenses. AccuView has come out with a contact lens that does the same thing, which is very cool, especially for athletes that can't wear sunglasses on the field. So a lot of soccer players like to use these. A lot of pitchers like to use these. Lots of different sports could benefit from this. Of course, we always take into account what their visual acuity is, making sure that they're not going to degrade their vision in any way. I also like that it has UV protection in it as well. So besides just giving them that little bit of an edge taken off, it has a safety little aspect to it as well. My one beef about this lens, it's not a daily disposable, which for all of my athletes, I really like them in a lens that they can just throw away at the end of the day, so less risk of infection. And if they're on the field, you don't have that awkward moment where they're like trying to find contacts, or something is in the contact, they can just chuck it and then put a fresh one in. It's nice and easy. These are some studies that have come out talking about the efficacy of doing stroboscopic training. The picture happens to be of Synaptech strobes that we use quite frequently in my practice, but there are a few other brands. It's something that if you haven't seen before, it's worth looking up, because basically they look like sunglasses, but they flash on and off. They go from being dark where you can't see through them to where you can, and then they're black and then you can see through them. So similar to if you put a strobe light on in a room or in a club or whatever, you only see parts of movement. So the idea is that if you do training where, again, think about a ball coming towards you, instead of seeing the whole ball's trajectory, you put them on a fast strobe to where I only see bits and pieces of that trajectory. And you train with this, and it teaches your brain to basically fill in those gaps. So then the training effect is you take the glasses off and the ball looks like it's going in slow motion. So there are many sports that this type of training could help the athletes. And again, for me, it's not just the enhancement, but the safety aspect as well. I think is very cool. You can get them to wear, you know, one eye strobes at a time. If you've got a receiver that's not really good at looking over and getting a full turn over their shoulder, you can flash one side. They do quad strobes, which are super expensive, and I don't know if those are really necessary, but FYI, they're out there and they're cool. So 632, let's get into a little bit about concussion vision rehab, because the sports performance end of things is fun to talk about. And there are a lot of those elements that we just hit that are also going to come into play being changed after an injury. And this is why I really love talking to you guys, and I really appreciate this opportunity, because what we know now about concussions is so different than what we knew even 10 years ago, right? Once we found out that there were long-term effects in CTE, we started caring a little bit more when there's an injury, and it's not just, you know, rub some dirt on it, shake it off, you got your bell rung, but how is this affecting you? And how long is it really taking you to pull out of these symptoms? And what's the likelihood if you go back too soon, you get injured again? And a lot of those symptoms are visually related, even though they haven't always been tagged as being visually related. So this is a publication called Brain Injury. They had 2 specific issues that were dedicated to neurooptometry. So I know I'm like the big eye nerd here, but I'll tell you they're really great if you wanted to check them out. One was in 2005, one was in 2018, and it talks a lot about the specifics, especially if you guys are into research and you want to know more details about how and why this stuff works. This is a letter that I helped draft that we sent back to the CDC as a reply to their guidelines for pediatric concussions that came out a few years ago. I'm sure you've seen them, and you may have noticed that vision is not mentioned in there once, except for the fact that they said that, you know, they might have photophobia or light sensitivity. So we sent them lots of information and tried to educate everyone as we do, and that's the whole thing. If you guys know, if the sports medicine and the athletic training community knows, that's really all that's important to us, right? Because you're going to be able to make those appropriate referrals to get them help. And it's not actually all that is important, because everybody needs to know this, because concussions don't just happen to athletes. And it's interesting that the majority of my concussion patients that I see, large majority, are athletes, but they're not all sports related injuries. Many of them come from my trainers that say, you know, oh, he hit his head on his bunk bed in his dorm room, or you know, my basketball player hit his head on the door frame. But the only reason that I saw them is because they were under the care of an athletic trainer that knew this is something that we should send them to Nanasy for. Or if you guys are in Central Florida or North Florida, send them to your local doc that you work with. So this is something that I just downloaded. This was from Mayo Clinic, describing all of the symptoms that go with concussion. And there's a big list here, not with vision. Here's another big list that has just sensitivity to light. And then I thought it was really interesting that they even have a partnership with King Vivic. And I was like, well, you know that saccades are interrupted, so why aren't we talking about that? So I was lucky enough to have my own concussion. It's been about 2 years ago, and mine was a motor vehicle accident. It wasn't the worst accident either, and I always like to point that out. It was we were rear-ended at a stoplight. I was sitting like this, and my head got thrown back into the A-frame. And I had already been seeing concussions for a while. And after having one myself, the way that I asked questions kind of changed a little bit, because I feel like I understood some of the symptoms a little bit better. And I'm sure I'm preaching to the choir, because most of you, I'm guessing majority of you have had concussions, typically where I'd say show of hands, and depending on who the audience is, it varies, and you guys have probably had your own concussions. But I just wanted to walk through some of those symptoms. Headaches, we obviously know about headaches. It's one of the most prevalent symptoms of anybody that has a concussion. And I had headaches, but of course it was just worse if, you know, somebody touched my big like hematoma that I had going on here, but it wasn't horrible. Nausea is something that I did experience, and I call this seasick because of course, like a week after I had my concussion, my mother-in-law had a birthday party in Tampa, like 4 hours away from me on a boat. So I was like the worst party guest ever. Here's a picture of everybody having fun at the party, but not me. I was like in the corner back there. I don't know if you guys can see my mouse or not, but like here's me looking at the ground for the for the majority of the party. And nausea is something that can very often be linked to vision. We think vestibular, right? But that whole system with eyes and vestibular have to work together, and they have to be in sync, or that's where a lot of stuff can kind of go awry. The next thing on the list was about light and sound sensitivity. I had my concussion about a week before the 4th of July. So I was like the nerdiest person at the at the fireworks ever with my sunglasses and my earbuds in. And this was the night before I got my my second injury related to the concussion that I'll show you guys later. But as you may know, all of your symptoms are kind of amplified with lack of sleep or cognitive strain. So not a big surprise that I had my next issue. So you guys remember this, like the more you know. This is really where vision comes into play, is when we talk about blurriness, which is often a symptom. So I went to work one day, again, after my concussion. I was like the worst patient ever, and I was working like the day afterwards even, which is probably why I had a really long, prolonged recovery. But it was a few days after that I was seeing a patient, and I was doing a dilated exam. So we hold up our little lens, and we, have our fancy little thing on our head, and we go to get a view of the back of the eye, and I couldn't focus. And I flipped my little lens over thinking I had it backwards, and I still couldn't focus. And I kind of flipped out because I was like, what is going on? So I finished up with that patient and then went to the back and started playing with flippers and had one of the other eye doctors refract me again. And I found out that my accommodative system was shot. Those of you that see a lot of concussions will know one of the other things that will very often happen after a concussion is a receded near point of convergence, meaning you should, for the most part, be able to follow something all the way into your nose without it going double. But because you have spatial issues after a concussion, I couldn't put anything closer than like way out here without being blurry or double. And if I just went to a physical therapist, they might do some sort of pencil push-ups or some near point of convergence exercise for me, which in general, of course, I do vision therapy myself. I love vision therapy. But I needed a change in my prescription. I needed kind of like the equivalent of a pair of over-the-counter readers. But my prescription is a -4. So I can't get over-the-counter readers for that. I needed an add power, kind of like a bifocal in my glasses, or in my case, since I was wearing contacts, a multifocal contact lens. So by putting that different power in front of myself, I could instantly focus better and bring things closer. So think about your student athletes, right? One of the things that we struggle with is getting them back to learn. Return to play is very important. Return to learn is arguably more important because they need to keep their scholarships, they need to go to school, and that's the step that will come before they can get back out on the field. So if you have someone that's having prolonged recovery, they say, I'm doing my homework and I'm getting headaches, or it's blurry, or it's double, or the words or the letters are moving around, then they need to see an eye doctor. I always tell my patients, it's kind of like we all have a bucket of all of the energy that our brain needs to function. And all of a sudden you've got some holes in your bucket. So I need to find either ways to patch the holes, like glasses, to basically give you a crutch until you don't need it anymore, or give you more energy, give you more gas in your tank, more water in your bucket. And that might be tools like looking at their eye posture and saying, all right, your eyes now look pretty straight right here. But when you look down, your eyes are doing this, which they used to not do because you could compensate for it, but now you can't. So while you're waiting for your glasses, or maybe even you don't need glasses, maybe you just need to point your nose towards your reading material. And it's the difference between being double and being single. So that's something that I keep looking at my watch because I'm just talking way longer than I should probably. This is something that I really want you guys to know. If someone's not getting better, think about getting their eyes checked. I'm gonna buzz through these a little bit faster here. I would never say I was dizzy. I don't know why, maybe pride, but I would say I felt unsteady or I lost my balance. So I ask that differently sometimes. There's something called a visual midline shift where you think this is center, you think this is center when this is actually center. So patients that have this will often knock pictures off walls, curb their tires, or totally dislocate and break their pinky toe. Those unicorns are there for your viewing enjoyment because my toes were not done, and I know what you're thinking, which toe is broken because I have ugly dancer feet, but it's the pinky toe. That was my kind of like secondary injury. There's my little x-ray. I have a story here, but I'm going to skip it. It involves me stroking this man's beard by mistake. It was very embarrassing, but I want to just show you guys one more thing. Visual motion issues I often had when I was driving in the car. You'll often get that. The eyes are liars. If you've ever seen this type of like funhouse tunnel thing that you go through, if your proprioception is in charge, you know your feet are flat on the floor. If your central vision is in charge and you just look down the hallway, you'll make it straight down the hallway. If you close your eyes, your vestibular system tells you that everything is fine. But when you open your eyes and see all of this peripheral motion and that is not making sense to your other systems, this is why we often have those types of problems, right? Last thing I just want to show you is that right eye can actually demonstrate to us normal eye movement. So up in the top right hand corner, this is the right and the left eye tracking something in a circle. It's the same ball that both eyes are tracking, but it shows you how each one is doing it separately. This is actually my baseline that luckily I had before my head injury. This is after. This is one day after. So if you look over here on the left, the red is my right eye, the left is blue, and you can see that those are not so great. If you jump over to the right side of the screen, you can see my horizontal pursuits. Think about if I was in school trying to read. I'm going to go to 2 days out. Back to the left side over here, my right eye is like, I am no longer participating in this circle drill. It's kind of doing its own thing. And then if you jump over to the right, you can see my horizontal smooth pursuits, my vertical pursuits. Imagine your athlete going back to school, looking down, looking up with this type of eye movement. This is something that can get better over time with treatment, either glasses or therapy. I'm going to jump through to just show you a different patient that wasn't me. This is a patient named Chris that was from Orlando that was in a motor vehicle accident about a year before I saw him. He had to withdraw from UCF. He saw me for the first day, walked down the hallway with sunglasses on, and he was literally leaning on the wall. These are his eye movements. The ones on the right actually are his circles. The ones on the left are the horizontal pursuits. I looked at him, took some measurements, put a pair of glasses on him with something special called Prism, and these were his eye movements like 5 minutes later. So needless to say, over time, he recovered fine and just needed a little bit of intervention. This was a fellow actually at one of the colleges in sports medicine, that the left side is his before and the right is his after. Same thing, car accident, but he did not need glasses. This was just after a couple weeks of him doing some active vision therapy and vision training at his house. So hopefully, even though I can't have a show of hands or even, hopefully you guys are even still there. I don't even know, but hopefully you understand there's a lot more to vision than 20/20. You understand the importance of a comprehensive eye exam to establish visual health and baselines. You understand the visual symptoms often experienced by concussion patients, and you know that there's intervention that can get those players to return to learn and return to their sport faster and safer. And there are some great resources that I'm a big fan of. 6:47. I wanted some time to just make sure I hit all of my test questions, if that's okay. So some of the common visual symptoms after a concussion that we discussed, we know that the near point of convergence can be receded. We do know that there's light sensitivity. We could have some problems focusing. Your prescription, as far as how your eye is shaped, is your prescription no matter what. It's just that sometimes we can't compensate for it. We talked about some different sideline assessment tools that we could use. Specifically for eye movements. One thing that I did not mention that I need to mention, VOMS testing. I talked about the relationship with vestibular system and the ocular system, and VOMS is a test that many of you I'm sure are familiar with that can do both of those things. I think that's it. I think we hit everything else. How do we do time-wise? I wanted to leave some room for questions. Not a whole lot, but sometime.
Yeah, we did. You did great. So thank you. We've got some questions here already to go through. The first question comes from Sarah, and she asks, is it only King Divic that you get their heartbeat up prior to performing a baseline test, or do you suggest doing that for other testing as well?
Great question. So for me, that's the only one that I would typically get their heart rate up for. I'm sure that I could probably get some slightly different results if I did that for other tests, but that is the only one that I specifically will do.
All right. And then Michelle has a couple of questions here. And the first one, they pertain to concussion and then doing different interventions or assessments in someone who's had a concussion. And so she asks about the eyes, dilating the eyes, and how that impacts concussion symptoms.
Ooh, good question. So oftentimes I will tell patients that, and of course, if they've had a blow to the head or any type of head injury that led to a concussion, it's enough for me to want to dilate them. It might exacerbate or provocate symptoms for them, especially if they're light sensitive, but it's an important step that I would recommend they have done just to make sure that their retina is intact.
And then she also asks, it's a little bit separate, but what about strobe training and how that impacts someone with a concussion?
Oh, with a concussion? So strobe training is something that I wouldn't do until someone was actually significantly better after the head injury. I will say that there's a lot of great research, even for athletes that have had like ACL injuries, doing strobe training during their recovery. But I would typically not throw a strobe on a person that's super visually symptomatic until I feel like they're past that shoot. In my clinic, on concussion days, they call me Johnny Cash because I wear black, because I wear a patterned shirt, and I've had patients literally like look at me and say like, I feel like I'm gonna vomit looking at you. So I learned to not take that personally and realize it's just my clothes. So I would be very careful not to induce symptoms.
So in terms of inducing symptoms, Tiara asks, with some of the tests, have you seen them induce something as significant as a seizure?
No, I'm going to knock on some wood. I have not. But anything's possible. I have had patients literally curled up in a fetal position on my floor, which is never my goal, right? And even when I'm working with the concussion patients on how to kind of understand their rehab, not only just doing vision therapy, but even just recovery in general, I'll kind of describe it like they're going up a hill, and here's your green, and here's your yellow, and here's your red. And it's okay to come a little bit out of the green, but just know that once you start getting into the yellow, you might need to bring yourself back back, because if you get into the red, it might knock you out for the rest of the day, where if you can kind of maintain that comfortable level, and I definitely don't want to push someone into that, but it happens, but no seizures so far.
Do you frequently utilize the blue light blocking lenses or the
Oh,
night?
I'm so glad you brought that up. Yes. So, so blue light is something that there's kind of a lot of controversy around, honestly, because a lot of doctors will say like, oh, is it necessary? Is it not? And the reason for that is because the jury is still out on some aspects of the research. Some people will say that it can lead to macular oxidation and damage long term, and kids are going to have age-related macular degeneration when they're younger. But two things we do know for certain. One is that they jack up your circadian rhythms, because that light used to only come from the sun. So now if you're on a big old bright screen at night, your brain thinks it's daytime, you're not going to secrete melatonin properly. And we know that if there's one thing concussion patients need to do, it's get on a regular sleep pattern. And the second thing we know is that it's harder for the eye to focus on that high frequency blue violet than every other color. And I love having this discussion around Christmas time, because if somebody has multicolored Christmas lights up and you try to look at all of those lights, the blue will always look more scattered. And that is why we like the blue light filtering lenses as an anti-fatigue factor. They don't have to be yellow like they used to be yellow, and the more altered the color of the lens is, I'll say, the more it filters. And we try to filter just the bad part out, but not everything out, if that makes any sense. Blue blockers, those ones are bad. Those cars cause car accidents, and you can't see the red from the green. And but blue light filter is awesome, and that's one of those things that we can give our athletes to put a little bit more gas in their tank, because they can do what they were doing, but a little bit easier. Thank you. Great question.
All right. The next question comes from Nadine. She asks if there can be any specific vision training done to decrease the incidence of motion sickness.
So it's a hard question to answer generally, right? Because you might have motion sickness because you have a imbalance in how your eye posture is sitting. So it might be something that you actually need a correction for. But in general, if there was no need for any correction, my favorite drill that I do is to just help to increase peripheral awareness, as well as work on their saccadic eye movements. And it's really hard to do like this. So basically, if I am, and maybe you guys can just kind of turn and look at something in your house, or look at your computer monitor. So if you pull your monitor far enough away that you can close one eye and put your thumb right over the corner, the left corner of your monitor, okay? My thumb is covering the corner of the monitor. I am only looking at my thumb in this left corner, but I can see that the right corner of the monitor is over there. So I say, try to take in where that corner is, and in one quick movement, move your thumb and your eye at the same time, and take in it. Did you overshoot it? Did you undershoot it? How accurate you were? It's not a speed drill. It's about localizing where you are in space. And then you're going to do the same thing with the bottom left corner, and then see how accurate you were, and then the bottom right corner. I'm doing a Z because that's basically how our eyes move when we read, and we're working on getting them back to school or back to work. So I would have them do that with each eye in 10 Zs, and then also 10 boxes. So left, right, down, down. So they also get that vertical pattern in. And that's something that I would say, use a big target, stand 10 feet from it. And then if it gets where it's easier, take a big step towards it and do the same thing, because the closer you get, the more visual space it takes up.
Awesome. Well, thank you so much for your time, for sharing all of your experience, and all of the really good tips. It's been a lot of information. So I know there's a lot of people who are asking about rewatching it and getting more pearls and tips from it on the next, second, and third view. So I really appreciate that.
Awesome. I did not get to my last slide, which had my email address on it. If you want to share it, it's Nanasy Nanasy, and those are all N's like November, Nanasy at sportsvisionpros.com. And I'm happy to answer any questions.
All right, that I'm sending to all in the question and answer box, so that's been done. And then just the last thing I have here is in regards to the email, and you'll get that 1 hour after the webinar concludes. That has the quiz and evaluation. You have 72 hours to complete that. And then our next talk is going to be tomorrow night. We have Dr. Michelle Joy, a psychiatrist from Philadelphia, who's going to be talking about mindful performance. So thank you, everybody, for attending. And thank you, Dr. Nanasy. Good talk.